Hi there, this is Dr. Scott Dunbar, and if you're watching this video, unfortunately it sounds like you have been diagnosed with a skin cancer that requires Mohs surgery. So first off, I know that this can be really stressful. Skin cancer is super stressful. The good news is Mohs surgery has the highest cure rate of any cancer procedure really on the planet. The cancers that we treat with Mohs surgery are almost never sort of dangerous or life-threatening. They're more commonly just a nuisance that we're very fortunately able to cure in the office with Mohs surgery. So I know this can be stressful. I know it can be a lot. We're here to answer your questions, but I kind of wanted to make this video to give you a little bit of a primer. Since a lot of times I don't meet my patients until the day of their surgery, this will give you a little bit of information about Mohs surgery and what to expect and sort of, hopefully put your mind at ease a little bit. So first of all, what is Mohs surgery? Everyone's like, what does it stand for? Mohs surgery was invented by a doctor named Frederick Mohs, so that's where the name comes from. It's a surgical technique where we take out a skin cancer and we're able to look at the entire margin under the microscope. That's really different from the old skin cancer surgeries where they would take a huge margin around a skin cancer and just look at a very small percentage of the margin and sort of hope that it was clear or cured. What I do, I look at every single microscopic millimeter of the margin, so I get the best possible cure rate with Mohs. So I tell patients, think of it like a Reese's peanut butter cup. So imagine that the chocolate is a skin cancer. So if you have a skin cancer on your face or your hands or wherever, what I'll do is I'll remove a cup-shaped piece of the skin with a narrow margin around the skin cancer. And what I'll do is I'll throw the chocolate away. So that the part that's in the wrapper, I'll throw that away because we know that there's skin cancer there. The dermatologist who did your biopsy prove that there is a skin cancer there. So what I'm really concerned with is the wrapper. So I take out that Reese's peanut butter cup and I lay the wrapper down and I look at the wrapper underneath the microscope. And that wrapper really is 100% of all the edges of that that cup-shaped piece of skin that I removed in the surgery. What I can visualize is that if there's a little bit of cancer left in the wrapper portion of the skin, then I know that there's still roots of that skin cancer left in the patient, which means I can sort of map out exactly where the roots are, and then I can take another cut or stage and just carve out that little root without taking a huge margin or taking any extra healthy tissue. So it's sort of the best possible combination of leaving as much healthy skin intact as possible and getting the highest cure rate, removing the diseased skin that exists. So what's the downside? It sounds like a great surgery, right? So the downside is every time I check that margin or that wrapper, it takes about an hour, sometimes an hour and a half, sometimes 45 minutes, but I say normally it's about an hour or a little bit longer to check the wrapper. What happens, to my patient while I'm doing all that work behind the scenes? Well, my patients are waiting. I normally will put a bandage on a patient after I take that first layer of skin. My patients will go to the waiting room and I'll be checking the skin under the microscope. As soon as I know if it's positive or negative, I'll either bring the patient back to do stitches or I'll bring the patient back to take another layer to remove the cancer. So that's kind of what's happening to my patients, and that's what I'm doing behind the scenes. If it seems like I'm, if it's been a long time, sometimes the lab gets backed up, but that's kind of, we're doing a lot behind the scenes in terms of checking the margins for the presence of any additional skin cancer. So average is about 2 layers or 2 cuts per skin cancer. Sometimes it's 1, it can be many, many layers, unfortunately, for some really, really challenging skin cancers, but average is about 2, which takes at least 2 hours, but then there's waiting in between and bringing patients to and from the waiting room. So the point is, the downside of the surgery is expect to be with me all day. We'll hope that, most of you are sort of out in less than all day. But if you're expecting to be there all day and you get out early, then great, everyone's happy. But what I ask is that you don't make any plans for sort of a lunch date or don't book any other appointments that day, or ideally you don't have a lot of other plans on the day of the surgery. What else does that mean? Well, I want you to be fed because a hungry patient is an unhappy patient. So eat a good breakfast before you come. Please bring some snacks. You can bring an ice chest with sandwiches or lunch or whatever you want. Just bring something to stay fed and stay hydrated because it can be a long day. The other thing is bring something to do. Bring a book to read or a computer to look at or an iPad or whatever you've got to sort of keep your mind off the fact that you're waiting for me to check your slides. I find that if you've got a good book, the time goes by a lot faster and my patients tend to be happier. So let's say your skin cancer is clear. Let's say we take our 1 layer or our 2 layers, your cancer's clear, great, it's time for stitches. So as a Mohs surgeon, I have extensive training in reconstructing skin surgery defects. So what we'll do is we'll bring you back into the room, I'll take a look at the defect caused by removing the cancer and decide how to stitch you up. I find that oftentimes my expectation for how many stitches a thing requires is much different than what my patient is expecting, because the reason for that is, most of my defects are shaped like a circle. You can't stitch a circle together because the edges would sort of pucker up like a boat on a 3-dimensional structure like the face. So what we'll do is we'll take that circle and we'll either elongate that circle or create a skin flap or use one of 1,000 different techniques to get that circle to lay flat on the 3-dimensional structures that we tend to operate on. So it is probably going to be more stitches than what you're expecting, but oftentimes by using more stitches than what my patients are expecting, you get a better cosmetic result. I try to blend scars into the natural lines of the face and wrinkles and, hiding things any way I can and reducing the tension to sort of minimize the scarring. So lots of tricks we can do to repair these defects, and we'll do that in the office the same day, unless there's a sort of an exception, but we can go over that in each individual case. And so really those are the main things. I ask you that if you're on a preventive blood thinner like aspirin, Motrin, Aleve, ibuprofen, fish oil, multivitamins, you stop any blood thinners that you're able to stop. Now, if you're on Coumadin or Plavix, most of the time you can't stop those, but if you're able to stop your blood thinners before the surgery, that'll make my job easier, which makes your recovery much easier. Much less bleeding, much less bruising, and you'll heal faster if your blood thinners are stopped. Other than that, we're going to go over a bunch of questions regarding history of surgeries and do you take antibiotics, and my office will call about that. But the number one thing I wanted to tell you is don't worry. The surgery is going to go great. We have an extremely high cure rate. It's over 99.5%. The cancers rarely come back. The recoveries are pretty short, and we don't have to use any general anesthesia. So things go great. You're going to do great. If you have any questions, please call me at the office. And if not, we'll see you real soon and take good care of you. Take care.